What makes a good orthopedic surgeon?
Two things. One is technical ability, because it's a surgeon. Okay. But more important than that, you could be a good doctor, good surgeon, if you don't have as good skills. To me, it's listening to patients. Patients will tell you what's wrong with them if you just listen. They've done studies that the normal, doctor interrupts somebody 45 seconds into their history. And I try not to do that. I try to listen, and they'll tell you what's wrong. So patients come to the doctor for several reasons. One is that they know they're hurt. They want to know what it is. They think they're hurt. They're not sure whether they need to have something done, whether that's playing ball or just working. And sometimes they're just scared. Their aunt had cancer. They've got this pain in their back. They don't know what's coming. They just want to be reassured. And so they come for a lot of reasons. And then, I'm in a service business. You know what I mean? It's me to greet the door, shake your hand. I'm Champ Baker. How are you? How can I help you today? And they'll tell you if you listen, why they're here. You know what I mean? And that's what I tell the fellas. We've got fellas. Your job's to determine why they're here. Give them a diagnosis. Here's what I think's wrong. Give them a plan of action, whether it's therapy, reassurance,
Options.
And then at the end, I always ask them a question. Let them know that they've got their nickel's worth, if you would. And that's what makes a good doctor. I think somebody who, at the end of the interview or the time with them, and it's usually pretty short, that the patient feels that he got his questions answered, he has an answer for why he came, and a plan. But Dr. Houston, he stressed several things he did. I'm never Dr. Baker. I always introduce myself as Champ Baker. I got to distinguish myself from my son, who's Champ Baker III, but because I'm a Jew.
And he's also a physician.
Yeah, he's a physician. But I introduce myself. I always sit. I'm 6'5". I don't stand. If I stand, it's a subtle thing, but I sit with them. I essentially touch every time I don't hold hands, but I make sure I touched them, and I sit with them. And that way, I think they get a reassurance, and then they'll sort of open up or tell you what's really wrong, which you've really got to ask them, And a lot of that's from Dr. Houston. He was never Doc. He was always Jack Houston. He was always Jack Houston to a patient. Now he was Dr. Houston to us, but to patients he was Jack Houston introduced, and he would do the same thing. And I learned that from him. And most of what I see is an injury induced. It doesn't have to be an athlete, but. So you're seeing the result of somebody physically doing something, and that's what sports is. It's an active process. So our business is to see people with problems, musculoskeletal, and most of those come out because they were doing something. As the oddball, I was in a car accident, but most people did something. And it may be as simple as walking in the garden and tripping. You get trauma too. And then our business is in orthopedics, and particularly in sports medicine, is to make a decision. Because you're on the sideline and he hurts his knee and the coach says, can he play? That's all he wants to know. He doesn't care if he needs surgery. He doesn't care what it is. Can he play?
And so that's a decision that has to be made
right
on the spot.
Right on the spot.
During a ball game.
And your priorities to the athlete, and is he safe to play? And sometimes he's fine. He's he strained his shoulders. He's safe to play. And if he's not safe, then you hold him out. And sometimes that's a problem. Depends on the coach and depends on the trainer how much it's a problem. But most docs work with teams, have a nice relationship with the coaches, and they trust their opinion. And that's what you've got to do as a sports doc. You've got to get the trust of the athlete, trust the trainer, trust the doc, trust the coach. Because your word dictates what happens. Athletes don't like to see physicians, trainer, because all they say is you can't play or you need an operation. And what you've got to do is get the trust of the athlete, so he'll tell you, yeah, doc, I really hurt. This is really a problem. And then you can treat him, because all they think you're going to say is, can't play, need surgery. And that's not really true, because all sports docs' interest primarily is making sure the athlete is safe to return to competition. And we care about who wins if you take care of the team, but it's not. It's about trying to be his advocate on the field, and then later on in the clinic. There have been a couple of lawsuits in the NFL because the doc wouldn't let the guy play. Talk about on a fine line, the docs in the NFL, because that's their livelihood. You say you can't play because you're hurt. I'll lose my bone. I'll lose this or that. And there have been a couple of docs sued because they would not. And they go get another opinion. Yes, you can play, because opinions are opinions. And so it's a fine line. Team doc really has to do what's best for the athlete. and sometimes that means it affects your status with the team. If you're constantly anti-team or anti-doc, anti-coach, rather, pretty soon, Baker, I get somebody who can say yes every time instead of no every time, you know. So it's a fine line.
But you got to be able to sleep with yourself.
You got to be able to sleep with yourself. You got to be able to do what's right. If you got hurt playing for school, career injury, there should be, just like if you got hurt in the workforce, that's what you're doing. There should be some compensation. The question is, who pays that? You know what I mean? And to me, the answer is the NC2A, because that's where all the money goes with all this other stuff. But they should set up something. If you bring a young man in to play for you, then your obligation is to feed him, house him, give his education, take care of his needs. And then if he's hurt and can't play anymore, then your obligation is to take care of him. Now, that's not forever and ever, but that is for a long term, or at least like a workers' comp. They get some compensation, I guess, for having played for a school and gotten hurt. They are getting paid. They get a 4-year ride, okay, tuition and books. It's not enough is the problem. You know what I mean? So the question comes in, what we give them to play ball for a school, is it enough? Is it just tuition enough? The answer is not. They need some supplement. I don't know what amount. Then the other problem comes in is that the schools are making a lot of money off of them. And so is it fair? And that's to me the second problem, is that how fair are you treating these kids? Because they're doing all the work, you're making all the money. So I think they should get more compensation. They're getting a scholarship now. I think the scholarship should be 5 years guaranteed, whether you stay or don't stay. Because right now it's a year to year. He's very gifted surgically, and what I like is he takes some of my man. He treats patients like I treat them, because we operate together same day. He does his, I do mine, and sometimes we share if we need help. But he has a clinic across me. We see patients Monday afternoon at 2 halls, so I can hear him talk to patients, and I get more and more. But he steals my patients, you know. The problem being a junior in the third is that they think the third is junior, so they come to see junior, but they end up with the third.
So that's a marketing issue for you, right?
Oh, it is. I says, look, if they come from Savannah, Georgia to see Chandler, they came to see me, not my son. But that's not how it works out.